Hello everyone, in this topic we are going to talk about laser tattoo removal. Tattooing itself is nothing new, it's a practice that actually dates back over 5,000 years. Over history, tattooing has indicated social ranking in many cultures, often being used to mark or brand slaves and sex trafficking victims, so that they're identified by their slave owners. It has also been used to show political status, as well as religious authority. While modern laser tattoo removal is a new and innovative process, tattoo removal, in some forms, dates back as far as tattoos themselves. In modern days, these methods would be considered quite barbaric, and thankfully they no longer exist. One form of removal named tissue expander for example, involved inserting a balloon under the skin and inflating it, to stretch then cut the tattooed area. A skin graft would then be taken to cover the removal, although it's unlikely this would be done in a sanitized, surgical environment in ancient times. Other techniques included microdermabrasion, where the face is sprayed with exfoliant crystals to remove dead epidermal cells, and even cryogenics, which involves freezing off the tattooed area. The earliest recorded form of tattoo removal was by Greek physician Aëtius, back in 543 AD. He used salabration, which basically saw coarse grains of table salt in a moist gauze pad abrading the skin until it reached the dermis and thus, the ink of the tattoo. As well as being a very painful process, the chances of scarring and pigmentation were extremely high when using this method. In short, ancient techniques were pretty horrendous, and entirely unsafe. This all began to change with the advent of lasers, and even those have come a long way since their first inception. It all began in 1967, when Dr. Leon Goldman utilized a 694 ruby laser and an ND YAG laser to remove a tattoo. This was followed by CO2 lasers in the 1980s, which required general anesthesia due to how painful they were, and finally short-pulse lasers in the 1990s, which were far more effective and didn't result in as many scarring and pigmentation issues. This was in part due to the theory of selective photothermolysis, created by Dr. Rox Anderson MD and John A. Parrish, MD, which enabled those removing tattoos to select tissue and use a specific wavelength of light to target said specific tissue. Short-pulse lasers are still widely used today. Since the 90s, laser removal has come on leaps and bounds thanks to increased investment and focus on technology, research, and training. However, as Fraser Watt, a physicist from King's College London, points out, in general it takes quite a long time for the commercial market to catch up with the latest technology being developed by laser system manufacturers. The most advanced and breakthrough technology being developed in scientific labs doesn't tend to quickly make its way to the commercial market, meaning some laser tattoo removal offerings today are dated. One survey found that a huge 78% of tattooed people regret at least one of their tattoos, most of them are at the age of 25 to 34 years old. To target this regret, there are several forms of tattoo removal available, and by far the most commonly used method is laser tattoo removal. Some older tattoo removal techniques are still around today, as well as the humble lasering approach. Dermabrasion, for example, remains an option. It uses a medical grinding tool to remove the outer layers of skin until the tattoo is also removed. Dermabrasion can be very painful, meaning an anesthetic of some form is needed. It can also result in considerable scarring. Dermabrasion may cause various minor side effects, including redness, swelling or bleeding, infection, changes in skin color. Surgical excision is another extreme method which is still available. It requires some form of anesthetic. It is very painful. Excision is much more suited to smaller tattoos. Excision may cause various side effects, including skin discoloration, infection, scars. Chemical peel. Using trichloroacetic acid to remove the outer layers of skin, including the inked portion. It's a hugely painful and unsafe way of removing a tattoo, and can cause blistering, scarring, or severe discoloration of the area. It's not recommended for those with darker skin tones. Laser therapy has become the preferred treatment for tattoo removal since it offers a low-risk option with minimal side effects. The tattoo is removed by using high-intensity laser beams to break up the pigment colors of the tattoo. The type of laser used generally depends upon the pigment colors. The laser selectively targets and removes the tattoo without damaging the surrounding tissue, which greatly decreases scarring. Skin is consisted of three main layers, each of them has its own properties. The outermost layer is the epidermis. Its thickness varies depending on where it's located, for example, It's thinnest on the eyelids with thickness of half a millimeter, and it's thickest on the palms of the hands and soles of the feet with thickness of 1.5 millimeters. The middle layer is the dermis. It contains connective tissue, blood capillaries, oil and sweat glands, nerve endings, and hair follicles. Its thickness varies from 0.6 mm to 3 mm depending on where it's located. The deepest layer is the subcutaneous tissue. It's mostly made up of fat, connective tissue, and larger blood vessels and nerves. Its thickness also varies from 1.65 mm to 18.35 mm depending on where it's located. To understand how lasers work, it's crucial to know what tattoos actually are first. When you have a tattoo done, molecules of ink are inserted directly into the dermis, the second layer of skin beneath the epidermis. Our body's immune system quickly detects the ink as a foreign body and send white blood cells to attack it. Unfortunately for the white blood cells, but fortunately for tattoo lovers, ink pigments can be up to 100 times bigger than the size of white blood cells, so the cells don't really stand a chance. This is how they become permanent. Lasers, however, have been developed to effectively break down ink pigments, making them small enough to be processed by the immune system. There are a couple of different lasers that are most commonly used. Q-switched laser and picoseconds laser. Q-switched laser generates nanosecond pulses using very high energies. The pulses that come from the lasers heat up the ink in a tattoo, often to temperatures of up to thousands of degrees. This energy expands and eventually breaks apart the tattoo ink molecules for the white blood cells in surrounding areas to remove them through the lymphatic system. While this may sound impressive, this excess heat that gets trapped can leak out into the surrounding skin, which can cause pain and damage. The laser can also cause what's known as frosting, a temporary white bubbling effect on the skin which is caused by bubbles of carbon dioxide produced by the laser's effect floating to the top layer of skin. The white bubbles might not look very nice, but the white frosting you see during laser tattoo removal is very much a good thing. This reaction indicates the laser is penetrating the ink effectively. On top of that, it also shows that your body is reacting and healing quickly. Then there's the picosecond lasers, slightly newer technology. They also use very fast pulses to transfer energy, but pico lasers release energy in picoseconds, therefore with picosecond lasers, energy can be released in a shorter time frame, meaning potentially less time for burning or other side effects. The pulses in picosecond lasers cause shock waves in the skin, called a photoacoustic effect, to shatter ink molecules, which are then removed by white blood cells in your body. This slide highlights the main factors behind the amount of time each tattoo removal would take. Larger and lighter colored tattoos need more sessions for complete removal. Furthermore, the ingredients of the ink making up the tattoo may increase the number of sessions needed, due to some ingredients containing chemicals which are more difficult to remove than regulated tattoo ink. Other factors include lifestyle factors. Those with weaker immune systems may find it takes longer, as your white blood cells are needed to remove the broken down ink particles. Doctors recommend trying to quit or reduce smoking while undergoing removal, which can aid wound removal and help your immune system behave more efficiently. Other steps you can take are to maintain a healthy diet and exercise routine, get enough sleep, and drink lots of water, while attempting to live as stress-free as possible. Laser tattoo removal looks different for everyone since each person and their tattoo is unique. As mentioned on the previous slide, many factors play a huge role on how many sessions are needed, therefore it is not possible to predict the number of sessions required for complete removal. Most patients generally need 6 to 8 sessions. Larger tattoos may take 10 treatments or more. To make sure the skin heals properly in between each session, most administrative staff schedule appointments 6 to 8 weeks apart to allow the skin to heal before undergoing another removal session. The average tattoo takes about 8 months to get rid of. When a tattoo is removed by an experienced and qualified practitioner, it is usually safe. Laser removal is by far the safest and most effective method of tattoo removal, and in fact, it's the only way to break down the ink without causing skin damage. Additionally, it is the only FDA-approved tattoo removal process. The major dangers of tattoo removal come from machines that are improperly built and maintained, as well as workers who aren't properly trained. Machines can cause serious burns, permanent damage, and poor removal when used in this manner. There are certain people for whom laser tattoo removal is generally considered unsafe. 1. Active skin infection/disease in the area to be treated. 2. Recent UV exposure of the treated area, including tanning. Future picosecond lasers were developed recently to overcome the limitations of Q-switched lasers. They emit energy bursts that last only a few picoseconds, or trillionths of a second. These picosecond bursts are significantly more effective than older Q-switched lasers at breaking down tattoo ink. As a result, they were able to cut the treatment duration in half. Instead of 15 sessions, they only needed 5.